Good morning. I am Dr. Sony George, Regional Head Clinical Services, Kerala Central of Dr. Agarwal's Eye Hospitals based in Cochin. Today I am going to talk to you about the Swiss Phob IOL, which is a new EDOF extended depth of focus IOL from Appasamy. In fact, I was on the lookout for a good EDOF IOL which is affordable to the patient at the same time with minimum aberrations like glare, flare, etc. Although I tried a few lenses, one of which is a multinational, I was not very happy and I was not getting the right amount of intermediate or near vision with these lenses. The Swiss Phob, in fact, I was chasing Appasamy for this lens, and I was fortunate to be evaluating this lens for about 2 years. It's a beautiful lens coming from the Appasamy staple, and it's a single piece hydrophobic aspheric lens with blue blocking, and this lens has an excellent polishing and an excellent surface, which itself will give very good optical qualities to this lens. Basically, how this lens is modified into an EDOF lens is by aspheric correction. So the aspheric correction is more in the center, and that helps give better contrast sensitivity and better depth of focus, and the central area gives you the intermediate and a very good amount of near vision. The peripheral aspheric correction gives very good vision, very good night vision, and the anterior surface of the lens is refractive, and that gives good far vision properties for this lens. In my hands, this lens works very well. The ease of implantation is very good, and this lens, especially when done in a micro monovision kind of situation where you correct the dominant eye for aiming at emmetropia and the non-dominant eye aiming at a slight myopic residue about 0.5 to 0.75. This lens gives excellent far, near and intermediate vision. When bilaterally done, 95% of my patients did not need any glasses even for near vision activities. So according to my statistics, around 67% of patients had uncorrected near vision of 6/6. Almost the same, 67% of patients had uncorrected intermediate vision of N6, and near vision also was achieved for almost 67% uniocularly. Binocularly, most of these patients, almost 67% of these patients had N6 binocularly. Around 23% had N6 to N8, N6 parts to N8, and maybe around 7% had N8 or less. So this way the patient is very comfortable, and although the company claims to give only good intermediate vision and fairly okay near vision, in my hands and with this micro monovision technique, I am able to give at least 70% of my patients uncorrected near vision of almost 6/6, and they are very comfortable. Only thing, because the light is split up, they may need a little more illumination while reading. For the far and intermediate, they don't need glasses at all. At a distance of maybe around 40 to 50 centimeters, maybe they may need a little more ambient light or some focus light while reading. So compared to this multinational lens, which I have said in the beginning, and few other Indian lenses, I feel this lens is far better as far as the range of vision is concerned at this economical rate. And in my hands, I've got almost 3.5 years experience with this lens. None of the patients had to undergo yak capsulotomy. The piece is remaining clear, and all the patients are very happy with the results. So I wish Appasamy all the very best. I'm just waiting for more innovation from Appasamy in this regard, and I have high regards to this company for the amount of research and development they have put it into the development of IOLs and other intraocular devices. Thank you.